Hello, and welcome to this video on using the NRFit epidural system. In this video, I will explain how to prepare and perform an epidural anaesthetic using the pre-made NRFit packs you will find in the anaesthetic department. Let's start with a little bit of background. NRFit is an industry standard of syringe devices and connectors designed for use in neuraxial and regional anaesthesia techniques and developed by Braun. It is deliberately incompatible with other connector systems such as Lure to improve patient safety by reducing the risk of wrong drug, wrong site errors. Let's now walk through preparing for an epidural. Having positioned your patient in the sitting or lateral position, it is now time to prepare your equipment trolley. You will need the pre-packaged NRFit epidural pack, sterile saline, a local anaesthetic. Here we are using 1% lidocaine, chlorhexidine spray to spray and clean the patient's back, a locking dressing and a tegaderm to secure the epidural catheter once it is sited, and finally tape to further secure the line on the patient's back. Begin by opening the epidural pack and setting out your equipment. Empty the pack out onto your trolley and open the covering. Take care to avoid touching the lighter side of the drape, as this is your sterile field. The contents of the pack are sterile, and as such you should only add sterilised equipment to your prep area. If you do not have sterile water as shown here, you may also need to draw this up separately, as you do the local anaesthetic. Next, add the locking dressing, followed by the tegaderm. Once this is done, it is time to spray the patient's back with chlorhexidine. While it is drying, wash your hands, then apply your sterile gloves and gown so that you can finish preparing your equipment trolley. It can be helpful to set your equipment out in the order you intend to use it, in this case moving left to right. The blue drape placed in the top right will be applied to the patient's back before you begin. Note the use of yellow plastic on the plunger of the loss of resistance device. This identifies that it is an NRFit connector. You will need to clip the wings onto the TUI needle as shown. The grey 3mm syringe is not NRFit, but a Lure connection. It is designed to be used here for the local anaesthetic. Attach the white filter to the yellow locket, ensuring you retain the yellow cap for the end of the procedure. The use of yellow caps, as seen on this needle, are also used to denote an NRFit connection. As you see, it will attach to the loss resistance device easily. If you try this with a grey needle, you will find them incompatible. To prepare the epidural catheter, draw up the saline using your loss of resistance device. Then take the catheter out of its packaging. Note the colour difference between the two ends. Feed the plain end into the locket. Clamp the locket closed and then attach the loss of resistance device. You will now be able to prime the line with saline. To release the catheter, take the green plastic device as shown and insert it into the locket. You may now remove the catheter. Preloading the catheter into the yellow plastic guide can aid with insertion later on. As the local anaesthetic ampule is not sterile, it will need to be opened by an assistant for you to draw up. The equipment is now prepared and you are ready to site the epidural. Having applied the sterile drape to the patient's back, you will then palpate the midpoint between the iliac crests to identify the L4-5 interspinal space, also known as Touffier's line. Begin by infiltrating the skin with local anaesthetic, aspirating prior to injection. Then, using your fingers for stabilisation, advance the TUI needle. You will notice a change in resistance as you pass into the ligaments. Remove the introducer needle. Now attach the loss of resistance device. Advance the needle by applying pressure only through the plunger, using the wings to generate countertraction. Once the needle passes into the epidural space, the plunger will depress. Note the depth of the needle using the 1 cm markers along its length. Here the needle is 5 cm deep at the skin. Now you may begin threading the epidural catheter. It should advance without difficulty. Once you have inserted the catheter approximately 15 cm, begin to withdraw the needle. Take care here that the catheter does not withdraw also. Once the needle has been removed, withdraw the catheter to a depth of 5 cm plus the depth at which you obtained loss of resistance. Here it will be 10 cm, which is denoted by the double bars on the catheter. Before attaching the locket and filter, thread the locking dressing onto the catheter and secure the line, again taking care not to pull out the catheter. You should hear a click as it engages. To confirm the catheter tip's position, look for meniscal drop. As the end of the catheter is raised above the point of insertion, the fluid column will fall. If it does not fall or even rises, this may suggest a dural puncture. Finally, apply the locket and filter. Using an NRFit syringe, aspirate the catheter. If there is blood in the catheter, this may suggest an intravascular tip and the need for resiting. If it is clear as here, then you are ready to apply the yellow cap and further secure the line using your tegaderm and remaining tape. For more anaesthesia videos, check out the rest of the channel.